MX.
Good afternoon, everyone. Welcome to the launch event of the first edition of the Planetary Health Course, translated and updated into English, a partnership between TelessaúdeRS and the Planetary Health Alliance. This event is promoted by the Institute of Advanced Studies of the University of São Paulo, TelessaúdeRS, the Brazilian Society of Family and Community Medicine, and the Planetary Health Alliance. My name is Joanna. I am a nutritionist working at TelessaúdeRS. I was responsible for the educational management of the Planetary Health course. In addition, I am one of the authors of the module on sustainable food, and I translated this module into English for this new version of the course. Feel free to put your questions in the chat, and if we have time, at the end we will answer everything. If you have any questions regarding the course and enrollment, please send an email to the contact available below. The link for registration is also in the video description. I will be hosting this event with Joanna from the Planetary Health Alliance.
Hi everyone, good afternoon. It's a pleasure to be here with you all today. As Ilana said, my name is Joanna. I'm the Program Assistant with the Planetary Health Alliance. Worked closely to help facilitate the translation effort of this course into English, working with so many incredible teams, including I'd like to shout out our volunteer translators and editors who helped make this course possible. So before we get into introducing our lovely panelists here today, I'm just going to go ahead and share my screen on a brief teaser trailer that gives a little taste of the course. One of our panelists, can you chime in and confirm you're seeing the screen? I can't see you guys.
Not the video?
Not yet.
Yeah, are you seeing the YouTube video?
Yes.
Okay, great.
Joe is not showing. It's click to full screen. When you click in full.
Keep it on not full screen, I think.
Yeah.
Okay, we'll just do this then.
Considered that we only have one home, that when smoke comes out of a car's exhaust pipe or a factory's chimney, that it doesn't just dissipate, but merely circulates before entering our noses and lungs, but that when we burn the Amazon, we are burning our home, our ecological life support system and hotspot of vibrant diversity. Scientific evidence shows that diseases caused by pollution were responsible for at least 7 million premature deaths in 2015, more than 3 times the number of deaths from AIDS, malaria, and tuberculosis. Increasing non-communicable and infectious diseases, from heart disease to dengue, are linked with rising global temperatures and land use change. There is no Planet B, but there is hope if we come together under a shared vision of planetary health for all. Planetary health seeks to understand and address human-caused disruptions and transformations to Earth's natural systems, and the resulting impact on human health and well-being. We can no longer separate our health from our environment. So what can you do in the face of our planetary health emergency? Take our free online course on planetary health to learn about the complex interconnections driving and jeopardizing planetary health, and find a community in the process. We are a community forged in urgency, and the time to act for planetary health is now. Save the date. This free online course will launch in January 2021 and is open to everyone, everywhere.
There's a quick overview of what's in store for anyone who registers. I'm going to now turn it over to Ilana to introduce our first panelist.
Thank you, Joanna. I think that all of us could taste a little the course. So our first speaker is Roberto Pierre. He is family and community physician and general coordinator of TelessaúdeRS.
Hi all, good evening. It is a pleasure and an honor for the TelessaúdeRS team to host the Planetary Health Course in our tele-education platform. The telehealth project of the Federal University of Rio Grande do Sul, TelessaúdeRS, completed 15 years of operation, and our focus has always been on the people served by our unified health system, SUS. With this objective, we help health professionals to serve their patients better and better. We did it through more than 300,000 teleconsulting to help primary healthcare professionals to solve the clinical situation of their patients. We did it by implementing telediagnosis service that attended more than 100,000 people with eye, respiratory, and dermatological problems. We did this in more than 30 different courses that certify more than 100,000 people. I am very happy that the educational technology we developed here at TelessaúdeRS can be applied so successfully to the Planetary Health Course. And I thank Mayara for accepting the challenge of creating the course following the model proposed by us, which proved to be a success in Brazilian version of the course that continues with open enrollment and has already had over 3,000 enrolled. The first time that subject of planetary health was discussed within TelessaúdeRS, brought by one of his great enthusiasts here in our state, Dr. Henrique Barros. He already told us that we were reducing carbon dioxide emissions with the reduction of unnecessary displacements of patients. We didn't imagine that today we would be in a partnership with the Planetary Health Alliance to launch the English version of the Planetary Health Course. We have high expectations for this activity because we know that it has the potential to make people more and more aware of planetary health. I thank Dr. Myers, Max, and Joana, Sociedade Brasileira de Medicina de Família, and Universidade de São Paulo, and once again, Mayara, and I wish with all TelessaúdeRS team a good course for everyone. Thank you.
Thank you, Roberto. So our next guest is Mayara Flos. She's an innovative woman whose head all these ideas came from. She is physician, coordinator of Planetary Health Course, and resident of Family and Community Medicine at Grupo Hospitalar Conceição.
Thank you so much, Ilana, and thank you, Pierre, for the words. It's been a pleasure to work with you all. It's been an hectic work into producing firstly the materials in Portuguese and then translating into English. But it's been very incredible to see the results for the Brazilian course. It's awesome. We get thrilled by seeing that we have for the course now the English version, people from all around the world that subscribe at more than 20 countries by now, and we just have like 3 to 4 days of the course open. And I think and I hope that we will be changing the world and changing the view of people of health and the understanding of the importance of our little revolutions, what I call, that we created with education and creating accessible education. I prepared this small presentation about the course for those that were seeing and to have an idea of what's coming. So the first thing, it's my huge thank you. That's all the people involved in this course. That's from design to contenters to people that work in management, to coordination. My special thanks to Pierre and Marcelo that firstly welcomed the idea, and the whole TelessaúdeRS team. I couldn't start to say names, otherwise I will do mistakes, because everybody helped and worked a lot. And to my colleague Carlos that coordinated the version in Portuguese, and now is supporting us in this version as well. So 76 people were involved in the design and the creation of the course and developing the content. We have 33 authors, 4 designers, 15 translators, and people working the copy editing adaptations, and then we have people in other works. It's a huge amount of people to coordinate, to bring in at the end, and to have something that people can see and say, okay, we have a form and we can do this course and we can join it. We have many course partners for this English version and for the Portuguese as well. And our huge thanks to Planetary Health Alliance and Max, Joe, Sam, and Mary, and everybody that's involved. It's been a huge work, and also on weekends. And I know that out of the off time, but we were being able to develop it. So my huge thanks. I will not cite all of them, but my heart is with you. Thank you for all the collaborations, for people that work it to develop this. It's been a huge achievement. So before I follow, I especially want to thank also Enrique, because he's been the inspiration on that's helping putting the hands on the course, but also the person who made myself driving into the planetary health. So what is this? Why is this course special? We have 100 hours of course that will be developed. That's planned to be developed in 10 weeks. We have initially we thought that we should have the people from primary care involved. However, we have decided to make the course open to anyone later, because we were in a conference presenting the course in 2019, and then a girl from the movement of the Fridays for Future in Brazil, she turned her hand up and said, why I couldn't do this course? I'm not a health professional, I am a student, but I want to do this course. And I didn't have a good answer to her. And then we have done a huge change on the course to make it accessible for anyone that wants to do it. That's why we have a glossary, so you'll be able to check the different words, new words, and keep checking. And we have done huge adaptations for everyone that wants to do that, having access to the course. So it's open, it's free of charge. We of course, TelessaúdeRS have a huge cost to maintain all of this. However, for you that's going to do the course, it's free of charge. You have a certification in the end, and it doesn't need high internet bandwidth, which means that it's accessible even in places where the internet's not that good. So that's what we worked hard to develop in this course. And just for you to have an idea, if we see the course in the front view, and it has this rhizomatic with the roots thing, in the different modules that come from climate change, heat stress, climate change and planetary health, heat waves and heat stress, air pollution, infectious disease, social participation to management, mental health, food, and water. And then you see this on the screen like in the front view, and then we have pre-tests, module questions, and audiovisual materials, which I worked so hard for being very short, not very long, and being very accessible. So you can have 4 to 5 minutes usually of videos. And if you do all the work, you will receive like badges, which was mainly based on the indigenous culture of the Brazilians and Latin Americans population. And if you see the course from the top, of course that we are playing with this front view and the top view, you see these roots, and these roots that connects all the modules and all the contents and all the roots that connect each other. So we have worked a lot about designing the course to make it very clean, light, and soft for the eyes as well. We have worked with the colors, we have worked with cause and effect, and it has some Fibonacci proportion. If you start the module covers from the beginning to the end, you see the evolution of the colors, and I will really thank the design team of the TelessaúdeRS, Yasmini, Lorenzo, Davi. You're being great on this. You have worked so high, and it's why we have this course going so far as well. And that's the badges that you will receive if you finish the modules. So I think that you can have an idea of the badges, and it will have a story with each badge. So, and then a little bit of the numbers. We have from the first course 2007, almost 3,777. We have 614 concluded, and that's what we have done. We are analyzing all this data. We have like a huge amount of good feedback. The average grade of the course for who have done it, it's 9.7, so it's a very high grade for a course. We have, for the pilot version, for this first version, we have read, and I thank you, Ilana, Angelica, and Anna, and everybody that was involved. We have read all the comments that people have done from the very first module to the end, to compilate it and then do an update on the materials. This was a huge work with the translation as well, because we want the most updated material for who is reading it. And this is what is special, that we have transdisciplinarity and innovation, accessible knowledge, and I think it's, as education is a human right, if we have this accessible for everyone in the world without any charge, we are talking about a more equitable world. We have evidence-based, but we have a smooth design, and we have an advocacy and activism proposal and interactivity in our forums. So we have the forum, and it has questions and images and things for you to think and to correlate with what you're learning in planetary health. That's much what I have for you today. And I do really thank you, all the team and all people involved, and everybody that's here organizing this launch. And thank you so much. That's all.
Thank you, Mayara. What a great overview of the course and everyone behind it. We've been talking a lot about the Planetary Health Course, and we would probably be remiss if we didn't take a moment to talk a bit about the field of planetary health and the origins behind it, and its importance in today's society and culture. So to do so, it's a pleasure to introduce Dr. Sam Myers, who's Director of the Planetary Health Alliance. Sam, thank you for being here today.
Thank you all for having me, and congratulations on such an exciting accomplishment. It's a huge amount of work from so many different people. So I'm like the guy that jumps into the race when there's only about half a mile left and gets to cross the finish line. So it's not really fair, but thank you for all you've been doing. And thank you for all the people that are enrolling in this course, because clearly you have a commitment to thinking about the world in a new way, which is really what we need in order to get where we need to go as a global society. I think we're finding ourselves right now at what really is a unique sort of moment in human history, where all of the really extraordinary sort of scientific and technological developments over the last several decades have led to extraordinary improvements in education and wealth and health for a lot of the people all over the world. And in many ways, there's never been a better time to be a human being in terms of human development. But those same scientific and technological developments are also fueling really an extraordinary ballooning of our global ecological footprint, and they're leading our collective activities to completely transform most of our planet's natural systems, not just the climate system, but the composition of life on Earth, land use change and pollution of air, water, and soil, and scarcity of resources. So our activities are transforming nature. And the core premise of planetary health is that the scale of those collective activities, the scale of the sort of human impacts now exceeds our planet's capacity to absorb our wastes or to provide the resources that we're using sustainably. And so as a result, we're transforming all of these different kinds of natural systems, and those changes, whether it's climate change or biodiversity loss or pollution or land use change, those changes are interacting with each other in really complex ways that we're just starting to understand, but that affect the really core fundamental conditions for human health and well-being: the quality of air that we breathe, the quality and quantity of food that we can produce, our access to fresh water, our exposure to infectious diseases, witness the COVID pandemic right now, our exposure to extreme weather events, even the habitability of many of the places that we live. And ultimately, these kinds of environmental change are now affecting every dimension of human health, and we worry that they may drive the majority of the global burden of disease over this coming century. So that if you don't care about the environment at all, if you're not an environmentalist, if all you're really thinking about is human health and well-being, you still have to be deeply, deeply concerned about the state of our natural systems. We cannot safeguard global health into the future if the life support systems that sustain us are crumbling underneath the weight of our collective activities. And so that's really the core, premise of planetary health. And the reality that all of us are facing is a sobering reality. And we have to acknowledge the seriousness of this moment. Our house is on fire, and we're in the house, and there aren't any exits. The good news is that we have lots of really excellent fire extinguishers. And so, across the board, when you look at every dimension of human activity, whether it's energy systems or our food production system or the way we manufacture goods or the built environment, the way we design our cities, or even economic theory and accounting, there are opportunities where there are all kinds of solutions to change the way we do what we do and to be much, much more efficient in our use of resources, to embrace circular economies, to build cities that really optimize physical and mental health and minimize our ecological footprint. And so what we need is really an army of researchers and policymakers and educators and practitioners who understand these connections between the way we manage our natural systems and our own future health and well-being, and who can come together to essentially create a whole new paradigm, to move from this sort of paradigm of extinction to a renaissance in thinking about our relationship, the relationship between humanity and the natural world. And we're not going to create that whole huge community of people working together without education. And so that's why I think this course is so incredibly valuable, and we need more courses like it. We need them in every language, but we're enormously excited to see all of your pioneering work putting this course together in Portuguese, and we're grateful to you for allowing us to help you translate it into English, and we hope that more and more people around the world will really come together in creating this new sort of planetary health paradigm. So thank you for all you're doing.
Thank you, Sam. Next up, to introduce and speak a little bit about the importance of community building in the planetary health community and discuss some other intricately related planetary health educational resources is Max Simberg from the Planetary Health Alliance. Max is our community building and outreach coordinator. And Max, thanks for joining today.
Thank you all so much to everyone who's watching and everyone who's here, and truly to the 76 people and beyond who have poured so much love into this course. You could see everything from the design, how the pink and the blue represent the circulatory system and the green and the blue earth, and how it's all intricate together. It's really just been such an amazing attention to detail and a big effort. So thank you to everybody. I think we've really seen exactly those solutions and the power of education and the fire extinguishers that you were talking about, Sam, just through this course. 2020 has been a really difficult year, this past year, and this course was launched in Portuguese. We've created this effort and have released some other really exciting educational resources during that time. So it just goes to show that even in this moment, we've all come together and tried to build something beautiful out of it. So for those of you who might not know a lot about the Planetary Health Alliance, I just want to give a little bit of background. So we are an international consortium of over 220 academic institutions, research institutions, NGOs, and some government entities from all around the world, currently over 50 countries, who've all come together with this mission of promoting planetary health and trying to understand how our transformations and impacts on our environment are coming back to affect our health in this interconnection, we're all talking about and is exhibited so well in this course. So our vision really is a world where all people thrive by protecting and regenerating Earth's natural systems for generations to come. So the PHA itself, we really want to promote, to mobilize, and to lead this very inclusive and transdisciplinary field of planetary health. And not just, the knowledge in maybe one way, but the science, the stories, the solutions, and the communities to achieve what some people have said on this call, the great transition, this shift in how human beings interact with each other and with nature. So the PHA really focuses on 4 main areas to do this. The first is community building. So encouraging and empowering a very diverse global planetary health community that crosses different sectors and disciplines, generations, geographies, and worldviews. And that's something that I think is really special about this course. Of course, just the emphasis on the diversity from Latin America and Brazil, but also expanding. And we hope that by adapting this course and reaching more people, everyone will bring their own worldviews and contribute in the interactive forums that will help with the community building and taking it back into their communities. The second is education. So we want to facilitate the education and the training of current and of next generation planetary health practitioners. And the PHA itself, we help to develop some educational resources that I'll talk about in a bit, but also curating other open access resources, providing mentorship and leadership opportunities in different programs, such as our Planetary Health Campus Ambassador program. The third is outreach. So what we call kind of mainstreaming planetary health. So how do we take our little communities, be it the health community or the academic community, and really try to bridge planetary health across the private sector, civil society, governments, whatever it is. And the last is really just action, promoting actionable steps. And we hope that's something that you'll gain from this course. So as you can see, with community building, education, outreach, and action, it's why we felt it was so important to support the adaptation and the expansion of this course, because it really is so mission aligned with what the PHA and the global community of planetary health, what we strive to do. So we're just so excited to be working with all of these partners and really feel like it's bringing us closer to our vision of a world where all people are thriving. So yes, I want to just shout out some of the educational resources that were developed in this past year that go so beautifully with this course, including a book that was written by Sam and a partner, Howie Frumkin, that really just complements this course so well. So you can kind of get a taste of something, and then if you want to read even more deeply, the book is a really, really wonderful resource. And as you'll see when you sign up, there's a little discount code for the book for participants of the course, as well as our planetary health case studies, which were also a huge effort this year. Yes, Antonio's showing the book. And that really shows how planetary health kind of starts at the theory, but how we really bring it into practice and come up with these planetary health solutions that bring together people from all these different worldviews and sectors and really adapt planetary health solutions to the very local context. So that's a really exciting and also free, completely free resource. And we're just so happy to be working with people who really believe in education as a right and have made it so accessible to all. So that is all I want to say. But yes, just a big thank you. And we hope that you take the course.
Thank you, Max. And for anyone who's interested in learning and staying in the loop on what's latest in the field of planetary health, I added into the chat a link to subscribe to the Planetary Health Alliance's newsletter, where every month we take submissions and try to collate some of the newest research in the field of research, events, opportunities in the field of planetary health to offer that to anyone and everyone who wants to stay up to date on everything that's going on. So we encourage you to sign up for that. I would now like to turn to introduce Professor Antonio Saraiva from the University of Sao Paulo. Antonio is a member of the Planetary Health Alliance's steering committee, as well as lead of our Planetary Health Annual Meeting Program Committee and conference host for the 2021 Planetary Health Annual Meeting. So Antonio, if you'd like to take us away and tell us more about the meeting and what it is.
Thank you, Joanna. Thank you all. It's a great pleasure to be here and sharing this virtual table, maybe this screen with you all, my friends. Yes, so let's say something about the coming event. So I will share my screen with you to show some slides. Let's see if it works. Just tell me if you see the slides, please.
Yes.
Okay, thank you. So we're going to have the Planetary Health, the 2021 Planetary Health Annual Meeting is going to happen in a little bit more than 3 months from now, the last week of April, between 25 and 30 of April 2021. It's going to be virtually happening in São Paulo, Brazil, virtually because of the pandemic, but there's trade-off, good pros and cons of that, but that's the way we managed to keep it going. So let's say something about it. The meeting itself is co-hosted by the University of São Paulo, where I am from, and the Planetary Health Alliance, of course. This is the 4th edition of the meeting. The first one was in Harvard, the launching of the PHA itself and the first event. The second was in Scotland, the third again in US in Stanford, and then the 4th would be in 3 months here in Brazil, virtually in this case. So as a motto, as the main theme for our event, we have chosen Planetary Health for All, bridging communities to achieve the great transition. Because we understand, we think, we believe that if we want to have safe planets, if we want health for all the planets, we need everybody engaged. We need to bridge all the communities, be it in terms of geographies, countries, of ethnic groups, or religions, whatever you may think of different groups. We need to have them all together so that we can do something to change the current status and the current trend of the planet, of our societies, to achieve a transition, to make a change to a more sustainable, more equitable, more fair, or fairer society. As I said, it's going to be a virtual meeting, free and open to all. So that's a good news. So everybody will be able to attend. We expect more than 3,000 people attending it. And the second big difference between the previous meetings is that we're going to have a full week. It's going to be a Planetary Health Week, encompassing both the annual meeting and the festival. So the meeting itself will have a core program, which will be live streamed to everyone. And as a regular meeting is going to have keynote speakers, panels, interviews, lightning talks, and posters. We're also going to have side events, workshops, symposia, panels, training sessions. And just pay attention because we're still open to receiving new proposals for side events. So check out the planetaryhealth.com website and submit your proposal for hosting a side event. It can be a workshop, a symposium, panel, training session, either globally or locally, in English or in your own language. We want to host everybody, to have everybody on board. We have chosen as main topics for our event what we consider pillars to achieve that great transition. So the first one is, what are the values, the foundational values for planetary health? If we want to achieve a transition, what are the values underneath our behavior, our way of living? And then the second is, what is the knowledge for planetary health? What is the science behind that? The third day is going to be about economies. What can be new models for the economy on the 21st and further centuries? The fourth day will focus on governance and cooperation. And the current pandemic has shown us a lot of things about the governance and cooperation, or lack of governance and lack of cooperation, which we need to think about. And then the fifth day is about social movements and social change. We understand the civil society has a lot to play for this change, all this change. Well, as always, we're going to have very important international scientists, but also policymakers, civil society representatives, private sector representatives, and influencers as well. So a very diverse audience in terms of speakers and also of attendees. This is just a brief overview of the event, but I won't go into detail on that. You can check it on the Planetary Health annualmeeting.com website. But basically each day has a theme, as I have just mentioned. And as I said, there's going to be a festival as well. So we want to bring art and culture for inspiring the change. So we expect music, gastronomy, dance, poetry, even graffiti, and all kinds of exhibits as part of all the kind of side events. And again, we're still open to receiving other proposals. So check our website and submit your proposal until the end of this week. And to support it all, we're going to use a virtual show platform. So it's going to be a really interesting and visually attractive and easy to navigate platform. Not only a bunch of Meet or Zoom webinars. It's going to be much more than that, with a lot of interactivity and also good stability and connectivity. So that's what I had to say to you. So please come join us, check the website, and if you want to know more, just send a message to that pham2021@usp.pr mail address. Thank you.
Thank you, Antonio. And for anyone watching along on YouTube, a link to the Planetary Health Annual Meetings website was dropped into the chat. Now, a couple of lines of conversation above, but as Antonio said, you can go on that website to learn more about our speakers, schedule, and to grab that email address if you didn't get a chance to catch it. I'm now going to turn things over to Ilana.
Thank you, Joanna. I would like to introduce Maria Inês Padula, a family doctor and representative of Brazilian Society of Family and Community Medicine. She will be talking about the next Ibero-American Conference of Family Doctors that will be hosted in Vitória, Espírito Santo State, in Brazil, on August 18th to 21.
Hello, everybody. Thank you for introducing me, Ilana. I am the current scientific director of the Brazilian Society of Family and Community Medicine. It's a huge pleasure to be here at this launch representing SBMFC. Planetary health has become an urgent and necessary issue for all human beings, in fact, for all living beings and the Earth itself. In this sense, the Brazilian Society believes that the current course has a significant contribution to make. Related to SBMFC, over the years, especially through national and international conference, the Brazilian Society has given us the opportunity to problematize and address this issue, especially the interrelationship it establishes with primary care and family and community medicine. Leonardo Boff is a usual speaker in our conference. Now I would like to bring you some news about the next Brazilian Society of Family and Community Medicine Conference in partnership with the Ibero-American Confederation of Family Medicine. In August, I will share the presentation. One moment, please. I'm not able to do that. Anna, could you, please? I'm not used to with Google Meet, only to Zoom, so I'm sorry. But the conference will be hosted in August, and will have the first World Conference on Planetary Health and Primary Care. And at the 18th. And some of the main objectives of the first World Conference on Planetary Health and Primary Care is to introduce and strengthen the concept of planetary health to primary care providers, to show how planetary health can reinforce the mission of family doctors in primary care, to explore opportunities and challenges for primary care providers in planetary health around the world. Following the first conference, the first World Conference, we'll have the first time in Brazil, the Ibero-American Conference of Family Medicine, who will take place simultaneously with the 16th Brazilian Conference on Family and Community Medicine. In this event, we are going to have 6 thematic axes, the main of which being the planetary health and primary care. This specific axis is to address, among other themes such as relationships between planetary health, primary health care, and health systems, planetary health education, highlighting the role of primary care and family and community medicine, and talk about the most prevalent disease resulting from different types of pollution, environment damage, and disasters. The event will be hybrid, and will have face-to-face and distance activities too. At the moment, we have registration open for sending proposals for scientific activities to the Congress, including the ones for the planetary health axis, as mentioned above. I I apologize for not being able to show my presentation, but that's it, and thank you so very much.
Thank you, Marinês. It was so clear, and we understand everything you said about the event. We are really excited about this event too. We appreciate the speeches of each of the panelists. Thank you for sharing so much with us. I think it is a great beginning for such an important course. And also I would like to thank Ana, who is the coordinator of teleeducation and communication teams of TelessaúdeRS. She is behind the scenes today operating this broadcast.
Thank you so much to all of our wonderful panelists. And we now have about 10 minutes left to open it up to Q&A. I've been following along in the chat, and I know that some of the questions have been answered live, but there are a few questions I see down here at the bottom that we can now start taking. So the first is one question from Milagros, which is asking, within the course, is there anything that focuses on clinically focused green space initiatives on hospital campuses? Is that discussed at any point? And that's for Mayara.
Yeah, we do have, it's more focused on primary care, but we do have the management module, which has a focus on this green space, and we do have like the design, interactive design of what we can do in your facility to think about primary healthcare and planetary health. And we have also like the promotion of activism on this module, which is correlated. So we do have, it's not the main focus of the course, but there is a module that's very related to it.
Great, and we have another question coming in on if the speakers for both courses are the same. And I think we've had a couple questions about any differences between the two courses. So I know one difference is the addition of the 8th module on water, which maybe you want to mention.
Sure. We do have done adaptations. It's not completely equal because we don't have the same resources in English and in Portuguese. So there is slight change, but there is. We also worked a little bit to don't be like too boring for who is not from Brazil. So we want to be a very like people get enthusiastic in the course, but essentially they are the same. And the second question is about the speakers, if they are the same. The course doesn't have like many speakers. They do have some 4 to 5 minutes videos. The biggest one is 10 minutes. And then they have subtitles, but we have worked more in activities and forum and interactions. So there isn't like huge, there isn't like a speaker or professors talking. Just maybe we have like recommended materials that people can watch this, but it's not the main focus to have this. Max, do you want to talk?
Yeah, I'll add something. As Mayara said, to make it accessible, whatever your internet access is, the course is mostly formed around the PDF modules with some of that interactiveness as well. On the adaptation front, as Mayara was saying, some slight adjustments just to make the audience a little bit broader. But in many cases, we still wanted to keep the spotlight on Brazil and on Latin America. And we think that it's very... it makes a lot of sense in the lead up to the annual meeting co-hosted with USP. So the way that the modules will come out, starting on the 28th, well, right now, Module 0 is open to help you get oriented. And then one module will come out each Thursday, starting on the 28th. So that will take us all the way to March 25th. The modules open in a staggered way, but they don't close until December 31st of this year. So you have the whole year to complete it, but all the modules will be open before the annual meeting. So it could be very cool to take the course, to get a primer on planetary health, and to even get some spotlights on the Brazilian context before the meeting.
Are there any other questions from our participants? One thing to add, in case this is probably clear, but one difference is that there are, for each course, there's also suggested supplemental activities or readings that, in addition to the kind of readings that you're asked to complete, to help you broaden your field of the topic each week. So those materials are different for each module. So Portuguese materials being listed for the original course and English content being newly sourced for the translation, for the translated version. So if you're bilingual and you want to get all of the material available to you, then looking at both courses is one way to do so. Kind of addressing this question in the chat of the possibility of subscribing to both. We were asked, how long is each module?
It depends. Like we work in a very soft design, so they are like 20 to 30 pages, sometimes a little bit longer, but the words are with very bigger, and then we have draws, and then we have like, there is more than 40 draws that we have developed and designs that we have developed for the course. So it's not just text. It is like images and graphics. So we have worked a lot to kind of break the text. One of the interesting things that we don't have like long texts. It's not usually doesn't have more than 4 paragraphs. We have like break it in questions. So have you ever heard about Anthropocene? And then you keep thinking, you start thinking about what is Anthropocene, and then we have like the next question, which will lead you to constructing the knowledge. So we will start, and then you probably do the first module if you already know a lot about planetary health. You see, oh, but they haven't talked about that or that. But we have decided to add the concepts like module by module in like a building. So the thing is that at the end of the course you have the main things that you will learn, the main things, but if it will be like block by block. And another question I think people were asking, we do have certification. If you are approved on the course, you will receive a certificate, and it's online. It's people can verify in a QR code, so you have access to it, and it's free of charge.
Great. And we were also asked if there's any communication channel with all of us. So I know the answer to that is yes, but Mayar, maybe you want to discuss the forum just a little bit and opportunity to use that.
Absolutely, Joe. The forum so you can register, and then when you open the module 0, you can, we have also like starting trigger for the conversation, like a question or an image or a song. Each week we will have a different thing, a poem. That's the part of the course which we bring, as Antonio was saying, like it's our festival is also in our forum, so we stimulate you to do it. We do have a special topic on the forum that we'll open later, but about arts. So everything that you think is related to planetary health, you'll be able to share. So we do have this place for sharing, and we think this is a very special place for sharing. There is some activities, like we have an action plan that will be done on the forum. If you want, you're not obligated. But it's like how we use this, everything that I'm learning, how I will put in practice on my daily life as a health professional or as not a health professional. So that's there is a place for interaction. Max?
Yeah, an additional note, excitingly, a project we're working on is the relaunch of the Planetary Health online community. So that is something, if you subscribe to our newsletter, that will be ready for the annual meeting. So if you join the course, you'll be a part of the community on TelessaúdeRS, and by the time you complete the course, you can join the online community on Hilo and to stay connected with everybody in the planetary health community around the world, which will also be free.
Great. I know we're just about at time, but one last question that came in and was answered a bit earlier in the chat, but maybe we could just answer live as well, is the question about certificates of completion at the culmination of the course and what's required in order to receive one.
Maybe Lana, can you answer it?
To finish the course and have the certificate, you have to answer all the questions from each module and reach at least 7 of 10 points. So if your grade is 7, you can, or higher, you can get the certificate.
If you don't, let me appear. If you don't, you can do again. You can do the course again. It's not a problem. You just ask us and we restart. So everyone will get the certificate.
Excellent. Well, I don't see any other questions in the chat. So once again, I'd just like to thank not only our wonderful panelists for joining and providing their insight on the course and planetary health and beyond, but also everyone who tuned in live to celebrate the launch with us and demonstrate, their interest and passion for planetary health. We're so excited for all of you to hopefully take the course and give your feedback. And thank you again to anyone who's watching who was part of the broad team that we mentioned earlier, who put in so much work and time to bring this course to life and make it a reality. It literally couldn't have been done without you, so thank you all. Ilana, do you have any last words?
I would like to thank everyone that gave some time for us to hear, and all the speakers too. It was so exciting to hear from all of you. Thank you.
Have a wonderful night, everybody.